Good morning, everyone. It is 12 minutes past 7 o'clock right now, and it is time for the Orthopedic Minute with our friends from DMOS. And this morning we have Dr. Nick Honkamp joining us in studio right now, and we are going to be talking about an injury that is very prominent amongst a certain collection of our population that might surprise you, Jackie. When he gets into the details on this, this is really going to be eye-opening. First of all, Doctor, thank you for being here.
Thanks for having me.
And we're talking about one of the most common injuries when it comes to your knee, right?
Correct.
All right.
Correct. Happens hundreds of thousands of times across the country every year.
And the injury we are talking about is?
ACL tears.
ACL.
Anterior cruciate ligament.
Okay.
All right, so Nicholas Honkamp, tell us, what exactly does that mean when you might be watching a football game and see a player go down, or something happens to you personally and people say, oh, it must be his ACL. What exactly does that mean?
So typically it's actually a non-contact injury. So
it is?
The vast majority of the time happens when nobody else touches you. Yep, so you change direction, you land, you pivot. And the ACL is one of the ligaments in the middle of the knee.
It is?
So
okay.
there's four main. There's one on each side, and then there's two on the inside. The ACL is right in the front, and it usually happens when the bones slide relative to each other a little bit too much with a little twist added in.
So what did you take off?
So what we just took off was the kneecap.
You took off his kneecap.
Okay.
Yeah.
And the tendon to open up the knee.
So it has nothing to do with the kneecap or
Nothing.
that kind of muscle that's running along the front, because that's what I always thought happened with an ACL.
Nope. So it's deep in the knee,
Deep
right
in
outside
the
the
knee.
middle.
Right in the middle of the joint there.
Correct.
Okay.
Correct.
All right. So you mentioned football players. We mentioned the conversation with football
I always thought it
players.
was a contact,
Yeah.
like physical activity was causing this to happen.
Yeah, or soccer players. You hear soccer players getting it a lot, but you said that really is not the primary target of ACL injuries.
So yeah, football can be just because of contact for sure, but non-contact is still way more common, and so you'll get it a lot in cutting and pivoting sports: volleyball, soccer, basketball.
Okay, and the population that seems to be really affected by this is
Young girls.
young girls.
Really?
So, say 13 to 18. Yep, the risk of that age group of a girl is probably about 4 to 6 times what it is in a comparable boy.
And do we know why this is?
There's multiple reasons they think. Some hormonal, some are anatomic. One of the things that we've kind of determined that is modifiable is oftentimes the way that young girls will land or twist and pivot is different than the way a boy will do it. And so girls tend to land from a jump with more stiff-legged or straight legs.
Okay.
And they tend to land knock-kneed or have their knees kind of together. And that's really hard on the ACL. And so one of the things that's a big push is that, can we teach these young girls how to land better with bent knees, think of it as kneecaps right over the toes instead of knock-kneed, and that has shown to decrease the risk.
It has. Now, does heredity or genetics have anything to do with this at all?
Yeah, I always think genetics has
think
something
so?
to do with everything.
With everything.
So if a parent had this going on, or a grandparent, you need to take precaution then.
Yeah, I mean, they just have shown that they're at risk, right? They have demonstrated the ability to tear it, and I think there is something genetically involved. But we try to focus on the modifiable things, right? Because you can't determine who mom and dad were, but you can determine things like how you land, muscular training, and so there's a lot of things that can be done. Most of the programs incorporate kind of using it like a 15-minute warm-up period to teach how to land and teach strengthening exercises so that they land better. Again, they land with bent knees, not knock-kneed. And that seems to help quite a bit.
It's amazing when you're talking the age range. Normally you would think, kids are young, they can bounce back pretty quickly, but how dangerous is it if you have a 15-year-old and they're already dealing with an ACL issue?
Huge, because probably 10 to 20% will either injure the knee again, the same knee, or the opposite knee. So it kind of sets the stage for, unfortunately, some rough.
Even at that young of age. So we just saw screens up there, prevention, and you were talking strength training, and just if you do have someone that's in sports, even as young as 15 or maybe even younger, how you want to get them into proper training, or what can parents take away from this morning that say, okay, I need to do this to make sure we're all living a healthier life and taking care of our needs?
So there's lots of ways. Some of the schools have athletic trainers that are very involved. I work with Urbandale High School and Grandview, and we have programs that are involved with the athletic trainers to teach some of these skills and some of these muscular techniques to learn how to land.
Even as far as
amazing.
into college, teaching them how to land when they're running or jumping.
Yep. You can certainly talk with your primary care doctor, with orthopedic surgeon, obviously, if you know one. Physical therapists are very familiar with this as well. So oftentimes if you're seeing a therapist or have another injury, this can come up as well.
Now, besides your knee just hurting, what are some of the other symptoms? Because you showed here, I didn't realize it's right in the middle here. What would be the first indicator that you have some damage to your ACL?
Pain and swelling. So
Swelling.
Your knee will swell up.
It will.
And then it just hurts. You don't want to walk. Most kids will stop playing immediately.
I was going to say, I always feel like when it's the ACL, you can't move. Is there an instance where you can be doing damage to your ACL, but you're still able to move to some extent?
Yeah, occasionally we'll have I don't know if they're just more immune to the pain, but we'll have kids that can get up and say, I want to go back and play again. I'm fine. But the majority will say, no, something's wrong.
I'm down for the count. Yeah. So what can you do about this then? What's the treatment for this?
Treatment is typically surgical.
It is.
For most people, you need an ACL to play cutting and pivoting sports. So if you don't have it, there are a few people that can cope without it, but most will require surgery.
Okay. And so what is all entailed with the surgery?
So typically what we do is we need a new ACL. And so what we tend to do is borrow a tendon from a different part of the body and use that to reconstruct or replace the ACL. And then the magic of the body, they'll take that tendon and they'll make it into a new ligament over time.
They will. And how long of a period of time for recovery is something like this?
Oh, it can be 6 to 12 months depending on the injury and the kid.
So I think the big message here is let's prevent situations like, we don't want to put you out of a job, doctor, but let's prevent injuries like this happening, especially our young kids, but as we get older as well. I imagine it's just as important to make sure we're utilizing our body in the best way so that we can be a little bit easier on our joints.
Absolutely, yeah. 6 to 12 months for a 14 or 15-year-old is an eternity.
But
it is when we get older, too.
Right. But it is repairable, and it's something that really needs to be taken care of, right?
Most times, yes.
Yeah.
Yep.
Okay.
Yep.
So now, people want to get more information in case something like this did happen to someone that you love. How can they get a hold of you to find out more information about this?
So they can go to dmos.com.
Okay.
There's plenty of information on our website, and then our number is 224-1414.
Okay. And you're which location are you at?
I'm at the West Des Moines location.
All right. Wonderful. Well, thank you so much, Doctor.
Thanks for having me.
We learned something about the ACL.
Great info today, and thank you for the work you're doing in our school systems to make sure kids are staying safe as well.
Thank you.
Thank you so much.